Hey there, and welcome to your NCLEX Art and Preparation session. Get ready to take your exam preparation to the next level with these practice questions. On your screen, you'll see two main sections, the question on the left and the answer choices on the right. But here's where it gets interesting. I'll read each question out loud, and as I do, you'll see a red highlighter moving along, keeping you focused on exactly what matters. Once I finish reading the question, you'll have some time to think through your answer. Keep an eye on the timer in the top right corner. It's your countdown to make the right choice. When the timer hits 0, we'll break down each option together. I'll show you why the correct answer is spot on, and we'll dive into why the other choices just don't fit. Plus, I'll share some pro strategies to help you tackle questions like a true NCLEX champion. Ready to crush it? Let's dive in. A patient is receiving a blood transfusion but begins to experience chills, muscle aches, rapid pulse, nausea, vomiting during the transfusion. The nurse suspects a hemolytic transfusion reaction. What is the most appropriate nursing intervention for a patient experiencing a hemolytic transfusion reaction? The options given for this question on the screen are Option A, administer antihistamines and corticosteroids. Option B, put the patient on oxygen therapy. Option C, correct hypotension, hemoglobin and RBC concentration and volume of blood. Option D, stop the transfusion, change the IV tubing, and keep the IV line open to normal saline. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is option number D. The most appropriate nursing intervention for a patient experiencing a hemolytic transfusion reaction is to stop the transfusion, change the IV tubing, and keep the IV line open to normal saline. It is important for nurses to be able to recognize and properly manage transfusion reactions, as they can have serious consequences for the patient. Hemolytic transfusion reactions occur when incompatible blood products are given and can cause symptoms such as chills, muscle aches, rapid pulse, nausea, vomiting, pallor, headache, and cough. Administering antihistamines and corticosteroids is appropriate for allergic reactions. Putting the patient on oxygen therapy is appropriate for severe allergic reactions, and correcting hypotension, hemoglobin and RBC concentration and volume of blood is appropriate for all transfusion reactions as a treatment approach, but the immediate intervention for hemolytic transfusion reaction is option number D. The most appropriate nursing intervention for a patient experiencing a hemolytic transfusion reaction is to stop the transfusion, change the IV tubing, and keep the IV line open to normal saline. The nurse should also notify the blood bank and the healthcare provider about the reaction and monitor and record the vital signs of the patient. All tubings, labels, and the blood bag should be returned to the blood bank after documenting everything. All right, let us see another question for further practice. By the way, the strategies we've been talking about in this video, those approaches for tackling tricky NCLEX questions and managing the different types of questions are actually taken straight from a resource I really recommend. The new NCLEX RN Practice Question Bank. If you're looking for a great way to practice and apply those strategies, this book has over 700 questions that mimic the real exam format, and each one comes with detailed explanations that help you understand exactly why the correct answer is right and why the others aren't. It's a great way to reinforce the strategies we've been covering here today. This book is especially useful if you're struggling with the new next generation NCLEX format or just need a structured way to build up your confidence with daily practice. You'll find it's all about practicing smart, not just hard, and really honing your test-taking skills. So, if these strategies are helping you out, this book could be a solid next step to boost your preparation even further. Just thought I'd share that in case it's something you want to check out. You've got this. A 36-year-old patient, Mr. Benav, is receiving a blood transfusion for anemia. After the first few minutes of the transfusion, the nurse notices that Mr. X is experiencing chills, muscle aches, rapid pulse, nausea, vomiting, pallor, headache, and cough. The nurse immediately stops the transfusion, changes the IV tubing, and starts normal saline through the IV line. The nurse also notifies the blood bank and the healthcare provider about the reaction and monitors and records Mr. X's vital signs. What type of transfusion reaction is Mr. X experiencing? The options given for this question on the screen are Option A, hemolytic. Option B, allergic. Option C, febrile. Option D, bacterial. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is hemolytic, or option A. Based on the symptoms described in the case study, Mr. X is experiencing a hemolytic transfusion reaction. Hemolytic reactions occur when incompatible blood products are given or when the blood type is not matched between the donor and recipient. The other options, B, allergic, C, febrile, and D, bacterial, are not consistent with the symptoms described in the case study. Allergic reactions are characterized by symptoms such as skin flush, swelling of the lips and tongue, and itching, while febrile reactions are caused by hypersensitivity to white cells, platelets, or plasma in the donor's blood. Bacterial reactions are caused by the presence of bacteria in the donor's blood. All right, let us see another question for further practice. A 25-year-old female patient is experiencing severe dehydration due to diarrhea. The physician orders a solution to be administered through an IV. The nurse hangs the solution and begins the transfusion. The patient's vital signs are monitored throughout the transfusion, and the IV is changed every 24 hours. Which of the following is the IV solution should be preferred for being administered to the patient in the case study? The options given for this question on the screen are Option A, 0.9% saline solution. Option B, 5% dextrose in 0.225% saline. Option C, 5% dextrose in 0.9% normal saline. Option D, Ringer's lactate solution. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is D. The patient in the case study is experiencing dehydration due to diarrhea. For severe dehydration, start IV fluids immediately. If the patient can drink, ORS should be given by mouth while the IV drip is set up. Ringer's lactate IV fluid is preferred. If not available, use normal saline or dextrose solution. Ringer's lactate solution is an isotonic solution that is used to treat extracellular fluid loss, such as from burn injuries, bleeding, loss of bile, or pancreatic conditions, or dehydration. Ringer's lactate solution is an isotonic solution that is used to treat extracellular fluid loss, such as from burn injuries, bleeding, loss of bile, or pancreatic conditions, or dehydration. It is administered through an IV and the patient's vital signs are monitored throughout the transfusion. Other types of IV solutions include 0.9% saline solution, which is isotonic and used to treat extracellular fluid loss when there is low sodium or chloride ion in the blood, and dextrose solutions, which can be isotonic or hypertonic based on how they are mixed with saline. Examples of dextrose solutions include 5% dextrose in water, D5-DUG, 5% dextrose in 0.225% saline, 5% dextrose in 0.9% normal saline, 5% dextrose in 0.45% saline, and 5% dextrose in Ringer's lactate solution. If you're watching this video and feeling the pressure of tackling those challenging NCLEX RN case studies, you're not alone. But what if I told you that the strategies and tips we're discussing here are all pulled straight from a game-changing resource designed to take your exam prep to the next level? Actually, the strategies for the case studies in this video is taken from NCLEX RN Case Studies Exam Practice Bootcamp. This book is packed with over 100 in-depth case study questions, each carefully crafted to bridge the gap between theory and real-world clinical practice. Whether you're dealing with anxiety or feeling unsure about the complexities of case studies, this book is the perfect way to transform fear into confidence. With a focus on first attempt success, this bootcamp will not only teach you the right answers, but also guide you through why other options don't make the cut, so you can learn from each mistake and grow stronger with every case. The author has helped countless students just like you conquer their NCLEX on the first try, and now you can benefit from their expertise too. So if you're ready to boost your confidence, master those case studies, and head into your NCLEX exam prepared like never before, the NCLEX RN Case Studies Exam Practice Bootcamp is your trusted companion. You can find it right now. The link of the book is given in the description below.